So I was at the Canadian Institutes of Health Research, which is the NHMRC equivalent in Canada, and I had 3 months before I went back to the university, and I had an opportunity last fall in November to be at a SAHMRI workshop, and I was asked to come back to see if I could help with the translational framework for the Institute. Really good question, and it means a lot of things to a lot of people, but I think there's generally agreement that it's really important, and it's about doing research that creates solutions to people's problems. And in the health system, it could be things like prevention and treatment and diagnosis and solutions to those kinds of problems, but it can also be ones around how to deliver healthcare more effectively and efficiently, and we know how much the healthcare system's under strain. So knowledge translation, research translation, is all about how do we use that research so that people, and those people can be managers in the healthcare system, they could be clinicians, they could be patients, it could be the public in general, how can they use that research and make really much better decisions? We had a project in Canada, and it was around leg ulcers, which people don't think is a very sexy health condition, but the people who have them suffer a lot. They're painful and it affects their mobility, and so they can't get around. And so the project was, well, how could we improve the healing rates? Really simple. And what we found out was the regional health authority, who's responsible for home care in Canada, aged care here, I guess, weren't actually using the best evidence. And so we were able to find the randomized controlled trials that said that if you used a certain kind of compression on people's legs, they'd heal better. And then the question was, well, how do we make that happen? And we had to train the nurses because they didn't know how to do that. We had to buy them equipment because they had to do special tests on people to find out what kind of disease they had. Then we had to reorganize how the nurses delivered care in the homes. And then we needed a process to actually measure, was it making a difference or not? And so by using the best evidence that was out there, we tripled the healing rates. A lot of money is invested in doing research, the conducting of research, by the federal government, by the state government. But if people aren't actually using the findings, it's kind of a wasted investment. So research translation is about how do we take those findings and get them to the people who can actually use them, make decisions, apply them in practice. So it's really about capturing the benefits of research. That's why we do research, right? So that we'd actually have better health outcomes, better system outcomes. But if people aren't using the findings, we've kind of lost that opportunity. And so SAHMRI is really well positioned because the whole focus of the Institute is around how are we going to get those findings to the people who can use them and make the best decisions, wherever they are in South Australia and even beyond South Australia. And if you look at translation more generally, like around the world, SAHMRI's, I think, perhaps one of the few institutes that's declared this is what our focus is going to be on. So lots of institutes focus on research excellence and finding discoveries. Way fewer of them actually say, okay, well, what happens after we have the discovery? And so a lot of what SAHMRI is going to be doing is, how do we get this information to the health department? How do we get the information to doctors and nurses and allied health professionals? How do we get it to the public? Because some of the things might be around prevention. And so that'll be an important, I think, distinction between SAHMRI and a lot of research institutes in Australia and around the world.